So for our project, we chose to do the social determinant housing. In class, we learned that housing is an absolute necessity for living a healthy life, and living in unsafe, unaffordable, or insecure housing increases the risk of many health problems. Housing impacts health because if people are spending ridiculous amounts of money on housing, then they can't afford to spend as much money on food or other necessities. Also, overcrowded homes can increase transmission of respiratory and other illnesses. Some homes lack clean water and basic sanitation. Housing provides a platform for self-expression and identity. Living in poor housing creates stress and unhealthy means of coping, such as substance abuse, and also lead, mold, poor ventilation, vermin, and overcrowding are all determinants of adverse health outcomes. So the outcome of housing insecurity is that it's linked to income insecurity, which in turn leads to illness and premature death.
So do you live on your own?
Yeah,
And when did you move to Victoria?
almost 3 months ago.
And how was it trying to find a place to live?
I camped in my friend's backyard for a week.
Did you have a lot of trouble finding somewhere to live?
I did actually.
Yeah.
A lot of problems there.
How'd you end up finding something?
Just searched and searched for months until
Yeah.
I finally got a place.
And did you have trouble finding somewhere to live?
Yeah.
Do you guys all live together?
We live together.
I live on my own.
How'd you end up finding somewhere?
Scouring the depths of Craigslist.
Yeah, that sounds right.
One of our roommates found a place, and we had to kind of get it within it was like a 3-day decision, and it all happened really fast because we wanted to lock it down
It's
before.
not easy. Yeah. Nice. And where are you from?
I'm from Edmonton.
Okay. A little bit different.
Very different.
Yeah. Is it easier to find somewhere to live in Edmonton?
Much
you think?
easier. Yeah. A lot cheaper too.
Yeah.
Heard about it basically word of mouth because I couldn't find anything else on Craigslist or anything basically. So
And is it affordable for you?
No.
We each pay a little bit different because our rooms are different sizes.
Yeah.
I pay $610 plus utilities.
I paid $550 plus utilities.
Okay. Not bad.
And then the other roommate.
We have two other roommates.
And
then the
two more
most
roommates,
Is
wow.
like 630.
$630, yeah.
Is that in like a house or is
Yeah.
it's okay, so a
We
house.
have like the
Yeah.
whole upstairs and basement entrance
And then tenants like downstairs.
So they're making a good chunk of money off
Yeah.
us.
Yeah, it's $1,500 for a 1-bedroom suite, but it's furnished and utilities in.
rent is pricey.
Housing crisis leads to an increase in homelessness, which increase premature death and mental and physical health problems. This issue puts burden on the healthcare system. The most affected populations are indigenous population and people with disability. For indigenous population, they are 10 times more likely to end up in an emergency shelter or being homeless than non-indigenous population. And for people with disability, they are more likely to have affordability problems than those without disability.
Luckily, there are federal, provincial, and regional programs to aid those in unstable housing or who are at risk of homelessness or who are already homeless. So John Howard Society of British Columbia is one of these programs. They're a not-for-profit charitable organization with chapters in several regions across British Columbia. So they assist individuals and families at risk of conflict with the law. They provide interventions and prevention services as well as public education. So John Howard Society has a homeless prevention program, and their philosophy is to provide services regardless of background, religion, mental health state, gender, or sex in a respectful, supportive, and secure environment. They provide assistance to those at risk of becoming homeless who are people transitioning out of corrections or hospital systems, women who have experienced violence or are at risk of experiencing violence, youth, including those who are leaving the care system, people of Aboriginal descent. So they aim to achieve those clients' personal goals. They connect individuals and families with stable accommodation or services to find and maintain stable housing. So the programs also join forces with several other programs to improve their offerings for their clients. So that includes Work BC Employment Program, the Harm Reduction Program, and Bill's Place. So BC Housing has another one of these programs. They have the Affordable Housing Program, which provides housing with rent equal to or lower than average rates in the market. It's targeted to people with low to moderate income who are eligible for subsidized housing. So the eligibility requires the ability to live independently. You have to meet Canada's residency requirements. You have to have a stable source of income, and you must be able to provide references. And if their accommodations are co-ops, then you must share in the tasks of the co-op. They have another program called subsidized housing, which is long-term housing for people who reside in BC, and the fees are calculated relative to income. They manage about 7,800 units available exclusively for those in need that they assist, and they also have access to some nonprofit and housing co-ops, which are both funded or subsidized by the program. The eligibility for that one is to be able to live independently as well. They have to meet criteria based on income and assets, and they have to be one of a family with one independent child at least, a senior or a person with disability, or a single person or couple with low income at risk of homelessness. They also have to be a Canadian citizen or a permanent resident, or a refugee sponsored by the government, or who has applied for refugee status. Okay, so BC Housing and affordable and subsidized housing aren't perfect programs. They do have some issues. So that includes that there's always going to be more housing needed than is actually available for people. So wait times for entrances into the programs can be lengthy. Some housing providers also select renters on a first come, first served basis, or some do it on a points system. This means that people don't always get housing when they need it the most. It also doesn't cater to the people who have a full-time caretaker. So BC Housing also has a homeless outreach program, which is pretty similar to John Howard Society's. It's a service for the homeless or the people who are at risk of homelessness. It offers referral to emergency shelters, planning to get identification and receive income assistance to find housing and support the application and move-in process, and they help to refer to supports including healthcare, counseling, and addiction recovery. It acts as a resource for housing providers or landlords to answer questions and concerns as well. So the eligibility for this program is to be living without a fixed address or living in a public place, such as on the streets, people in need of housing in cold or wet winter months, those who have left hospital, correctional, or rehabilitation systems, or financially, sexually, or emotionally vulnerable people. It's also in place for people who don't have a rental agreement or who have been given notice and are having trouble finding somewhere to live. One of the issues with this one is that it only works for people who are 19 years or older, except in rare circumstances.
So homelessness impacts on nursing in many ways. Nurses have the responsibility to promote, educate, and advocate for homeless patients, being aware of every aspect of housing that affects human health. So there's 3 parts of housing to consider, and it's the house, so the physical structure. So like Victoria had stated, there can be issues like overcrowding, poor ventilation, insect infestations, and so on. The home is like the social and psychological characteristics. Mental illness is heavily correlated with homelessness, and 33% of homeless people suffer from mental illness, whether it's triggered by their living situation or their mental illness affects their ability to maintain a suitable housing situation. The neighborhood is like the physical location and available services. If their location is perceived as unsafe, they experience higher rates of anxiety disorders. So on the shortage of housing, Victoria is experiencing a housing crisis. People from the ages of 19 to 25 are 80% more likely to experience homelessness in Victoria. Women and young children are escaping home violence and consist a large portion of those seeking homeless agencies. It is also becoming extremely difficult to secure housing for low-income residents such as students, families, seniors, Aboriginals, and those disabled. 1/3 of Canadians do not own property, nor their parents. With the drastic increase in housing prices, Canadians will be renting their whole lives, thus continually feeding money to their property owners. So the rich stay rich and the poor stay poor. So on short-term rentals, there's a discussion of ban on them by the Victoria Council in hopes of opening a better rental market. For example, Airbnbs were growing. However, it is negatively affecting the rental opportunities for long-term tenants because landlords prefer the ability to charge more for shorter stays. This cuts down on housing options for families, students, and seniors in search of an affordable place to live. Some of the ways nurses are helping is street nursing. So it began in 1986, and it's nurses who work with those living in extreme poverty. Some things they do are distribute contraceptives, they do HIV and pregnancy testing, diagnosing, treatment, develop meaningful relationships. They have mobile units for transportation to safe places, referrals and education, and they also do needle exchange and abscess care. So there's a program in Calgary called DOPE, so Downtown Outreach Addiction Partnership, that advocates for homeless individuals to assist them towards better access to shelter, health services, addiction treatment, and housing services. They aim to encourage decision making and self-determination.
So, one of the hardest aspects of street nursing comes from working with the people who have suffered incurable trauma in their lives. That kind of leads to addiction or mental health issues or suicide. Some of these past issues are from generational trauma that continues to plague the majority of the homeless people living on the street. It's this cyclical effect that leads continually to not any change or improvement in homelessness. It saddens me that people are born into these situations, and it also saddens me that medical and even social interventions continue to fail. Homelessness isn't really the issue. I think the issue comes down to the functionality of the way that our systems have evolved to respond. For me, the most rewarding part of that work is the rare opportunity you get to see people absolutely at their rock bottom and taking action to help that person in that moment, because that's when you have the biggest opportunity to fundamentally help that individual change their life and their mindset. The demographic of the homeless community I worked in consisted mostly of single men of a variety of cultural backgrounds. Street nursing really wasn't effective as I'd hoped or initially thought that it would be. Success rates in terms of restoring homeless or addicts or mental health clients to base level functioning is quite low overall. Most of the success stories I saw have come from an individual with a solid support network outside of the homeless community and sector. There are times when you definitely feel you made meaningful relationships with people living on the street. I found that working on the DOPE team, not discrediting any of the amazing people in the following sectors, that homeless people trusted us more than workers in the hospitals or homeless shelters, or supportive housing programs due to the hands-on nature of what it is that we were doing with our clients. Our workspace is a place of openness and taking action to assist those people struggling. No judgmental attitudes were accepted in our environment. However, I felt that even though we were able to develop somewhat of a strong relationship with some clients, they would still see us as workers and would never really give us their full trust. Mental health is such a tricky issue. It's amazing to me that even though we are so technically advanced that we still haven't found methods to cure mental health issues. I truly feel that the mental health and addictions issue is a spiritual issue. However, I suggest proper pharmacologic therapy, which includes not overprescribing medications and monitoring the doctors who are prescribing these types of medications. I believe a reworked institutionalization program, not like the ancient electric chair programs, could help with many of the mental health problems we deal with, as well as reduce homelessness and reallocate spending to trying something new.